Hi, and welcome to Cenario, your partner in mental wellness. Here on our channel, we share educational, insightful, and science-backed content to help you understand your mental health and take meaningful steps toward a more balanced life. If you're ready to learn, grow, and take control of your wellness journey, let's jump right in.
Today, we're going to tackle a medical procedure that, let's be honest, has been surrounded by myths and fear for decades, mostly thanks to some pretty intense portrayals in movies. Electroconvulsive therapy, or ECT. It's time we separated the Hollywood fiction from the modern medical fact. So, let me just ask you, when you hear the words shock therapy, what's the first image that pops into your head? Yeah, for a lot of us, it's probably some dark, scary scene from an old film. But that image, it's a ghost. It's a version of a procedure from almost 100 years ago. What if I told you that today, modern ECT is one of the most effective and fastest treatments we have for very severe mental illness? So, to get to the truth, here's our game plan. We're going to dive into what modern ECT actually is. We'll look at who it helps and why it can be a total lifeline. We'll walk through the entire procedure step by step. And then, we're going to talk about the side effects head on. By the end, you'll see why this is still such a powerful and often life-saving option in medicine today. Okay, first things first. Let's just clear the air and define exactly what we're talking about when we say ECT in a modern hospital. Trust me, this is not your grandfather's shock therapy.
So here's the clinical reality of it. ECT uses tiny, incredibly controlled electrical pulses to cause a brief, therapeutic seizure. Now you might be thinking, a seizure? Why? Well, while we're still studying the exact how, the leading idea is just incredible. It's like a hard reboot for the brain's neural circuits. It seems to reset and rewire the very brain chemistry that's driving those severe mental health symptoms.
And let's be super clear here. This is absolutely not a first-line treatment for just feeling a bit down. ECT is reserved for the most severe, often life-threatening conditions. We're talking about deep, treatment-resistant depression where absolutely nothing else has worked. Or really urgent situations, like catatonia or intense suicidal thinking, where you literally need relief as fast as possible. And, for the people who are battling these conditions, ECT isn't just another option on a list. In many cases, it is an absolute lifeline. Just try to imagine it. You've gone through different medications, you've tried different therapies, and nothing is working. You feel like you've run out of all hope. Well, this is where ECT comes in. It offers a very real chance at recovery. So many patients see huge, sometimes just profound improvement when nothing else could even touch their illness. And one of the most stunning benefits? It's speed. You know how most antidepressants can take weeks, sometimes even months, to really start working? Well, with ECT, patients often start feeling remarkably better after just a few sessions. That kind of speed isn't just a nice-to-have, it's a critical, life-saving advantage. This quote right here, it just says it all. When you're dealing with severe suicidal thoughts, or a person who's completely stopped eating or drinking because of their illness, the rapid relief from ECT can be the one thing that pulls them back from the very edge. Okay, so we know what it is, and we know why it's used. But what does the procedure actually look like for a patient today? Let's walk through it, because really the best way to get rid of the myths is to understand the calm, controlled reality of it all. It all begins way before the treatment room, with some very careful preparation. A patient gets a complete medical and psychiatric evaluation to make sure it's the right and safe choice for them. And of course, the decision is made together with the patient, who gives fully informed consent. It is a highly controlled medical process from the absolute get-go.
Now, the procedure itself. And listen, this is probably the most important part to understand. The patient is completely unconscious under general anesthesia. They feel zero pain. They're also given a muscle relaxant, so their body stays completely still. All the while, a whole medical team is monitoring their vital signs constantly. The actual therapeutic seizure, it lasts less than a minute. It is a world away from those scary movie scenes.
And the recovery, well, it's also surprisingly fast. Patients wake up about 15 or 20 minutes later in a recovery room. Yeah, they might feel a little groggy, maybe have a headache, but that usually fades really quickly. In fact, most people can go home and get back to their normal day just within a few hours. And this isn't a one-and-done kind of fix. A standard course of ECT usually involves a series of sessions, maybe 2 or 3 times a week for several weeks. This approach is what allows for the best and, most importantly, the most lasting results. Now, of course, a procedure this powerful is going to raise some questions about safety and side effects, so let's just tackle the biggest concerns directly and stick to the facts. All right, let's put this one to bed for good. The fear that just won't go away is that this is some painful traumatic event. The medical reality could not be clearer. Because of the general anesthesia, the patient is asleep. They feel absolutely nothing during the procedure. Period.
Okay, let's talk about the most common concern, memory loss. It's really important to be specific here. The vast majority of memory issues are short-term. They usually affect memories for events right around the time of the treatment itself. For most people, their memory actually gets better once the treatment course is over, because the underlying illness that was clouding their thinking has lifted. Now, can serious, long-term memory loss happen? Yes, but it is rare.
And beyond memory, well, the other side effects are usually pretty mild and temporary. Things you might expect after any procedure that involves anesthesia, like a headache or some muscle aches. But these almost always go away very quickly on their own.
So, when we bring all of this together, what's the big picture? How should we really be thinking about ECT here in the 21st century?
The bottom line is this. Over decades of medical progress, ECT has been completely transformed. Today, it is a safe, controlled, and, for the right patient, an incredibly effective and compassionate treatment that gives real hope when other treatments just haven't worked.
Which kind of leaves us with one last big question to think about. The journey of ECT, from this feared, misunderstood procedure to a refined medical tool, is really a powerful story about science. And it makes you wonder, doesn't it? How do we make sure our perceptions keep up with reality? Not just for this, but for all parts of medicine. Thanks for watching.
Thank you for watching Cenario. If this video helped you, don't forget to like, subscribe, and share. For personalized mental wellness supplements, visit Cenario.com. See you in the next one.